Hello, everyone. This is your host, Laura Michelle Powers, and today I'm very excited for the topic we're going to be discussing. We're having Dr. John Osborne on the show from ClearCardio, and Dr. Osborne is a preventative cardiologist and holistic heart health expert, and we're going to be talking about heart health and how to understand what's really going on for yourself and what you can do about it because I believe that heart disease is the number one cause of death in the North America, at last I heard. It's a very serious issue, and a lot of people don't know where to start, or they think that they're okay and maybe they're not, or they've gotten some misinformation because a lot of the tech that is currently being used is not as advanced as it could be. This is a subject that's very close to my heart because I have grandparents that passed from heart disease. And so I really want to educate as much as I can and help people understand their options and be educated so they can make the best choices for them and their loved ones. Thank you so much, Dr. Osborne, for being a guest on the show.
Oh, no, thank you so much, Laura, for having us. And thanks for your dedication to helping me. As I like to say, my ultimate professional goal is to eliminate heart disease. And anyone that's out there partnering with us to help eliminate heart disease, I am incredibly grateful for. So thank you.
Mm. Yeah, I think there's a lot of tech out there that at the time was the best that we had and is still being used currently today. And a lot of this is just about informing people that there are better options out there now for
Yeah.
them. So, yes, thank you for doing what you do. I'd love to start out by just sharing a bit about your story, how you got into this, why you focused on preventative cardiology specifically.
Yeah, sure. So, when I was a little kid, I wanted to become a doctor. That was kind of fixed. That's what I'm gonna do. I want to tell you, fourth grade though, I wanted to be a fighter pilot. Found out I had to wear glasses, so I had to go to Plan B, which is become a cardiologist. So it worked out okay. But I always
No Top
wanted
Gun for you.
no Top Gun, alas, which is probably good for them and just as well for me. So I always knew I wanted to go to go to medical school, and so I won't bore the details, but I ended up in medical school at age 19, and about 3 years younger than everybody else. They could drink, I couldn't. And so when I got to medical school, I thought, well, I'm kind of young, might as well. I got some extra time versus the other people there that were older than I was. So I thought, maybe I'll go ahead and get another piece of paper. So I decided to also get into the MD PhD program there as well. This is in Philadelphia. So I got into their MD PhD program as well. Did that and was able to, in the span of 8 years, get my undergrad done, my MD and my PhD, all in the span of 8 years. It's pretty good. So by 26, I had my MD and my PhD, and from there, I wanted to go to the best training program for cardiology, and I would say it's an arguable point. I think it still is the best, but I'm biased, and that's the Harvard program at Brigham and Women's Hospital in Boston. So now Brigham and Women's Hospital is now merged with Mass General, so now it's Mass General Brigham is the current nomenclature there, but back then it was the Brigham and the Mass General. So I went up there, wanted to do cardiology there. So I did my internship residency cardiology training there. And this is where I got the first sort of glimpse of preventative cardiology. Because in the old days, we would do heart caths, angiograms. So that's where they take those tubes or catheters, put them up in your groin. Nowadays, we put them in your wrist, put those up into the heart, inject dye into the vessels, and see if there's blockages, right? So pretty crude technology. And I will say it really dates from the mid 50s is when we started doing heart catheterization. So it's been pretty much unchanged for almost 70 years.
And
So
I would expect, I've never had this, but probably not very pleasant as far as an experience goes.
no, I mean, if you've ever had a colonoscopy, right, we give you the medications to make you feel, twilight and all that stuff. So we use the same kind of medications because you really don't want to feel somebody putting big catheters or tubes in your groin or in your wrist or up in
Exactly.
your heart and all that stuff. You just want to sleep through it. So when we did that at Harvard, we would get people coming in from all over the country, other countries too, to have us look at them, get them checked out, all that stuff. And what would happen is we would do our angiogram or heart catheterization or cardiac cath, as we call it. And we'd say, it's fine. There's no blockages, right? But if you look at the films closely, you could see there was what I'll call some lumpy, bumpy stuff, some little minor irregularities, right? That it wasn't completely smooth. And it just struck me that, we were kind of blowing that off, like, not a big deal. Who cares? No blockages, move on, go on to the next case. And I thought, you know what? That lumpy, bumpy stuff is something that is the early plaque that's beginning to form in the blood vessels. We couldn't see it very well because on a heart catheterization, by the way, it's actually a fairly limited test. All we can see on a heart catheterization, if you think of the blood vessel as a donut, all I can see on that test is the donut hole.
Mm.
However, where plaque starts and really where it festers, um, and where all the activity go is for years to decades is actually in the blood vessel wall in the donut, not the donut hole.
Outside.
So,
This was a
right,
revelation for me. I've always thought the primary
right,
issue is inside the vessel, and never
right.
really thought much about
That
outside the vessel what's going on.
Exactly. So it's all the activity, literally for years to decades, is all occurring in the wall of the vessel in the donut, I like to say. Okay. If you're from the
Right.
Northeast, we'll say a bagel, but I call it a donut. The donut hole is fine for literally years to decades. There is no impact upon the donut hole on the channel or the we call it the lumen where the blood flows. That only occurs really, really late, literally after decades, into the disease of plaque. So what happens is you get this soft, buttery, fatty plaque that builds up in the wall of the vessel, in the donut. The donut itself will literally expand outwards in order to warehouse or accommodate that soft, fatty plaque. All the while, the channel is fine. There is no blockage in the channel. There is no blockage in the donut hole. And literally the donut, the vessel wall, can double in size and can warehouse that much plaque. All the while, it's growing outwards, not inwards. And what happens is these plaques full of cholesterol, lipid, soft plaque, as we call it, those are all synonyms, is very fragile. This is the stuff that can, we use the term rupture, but imagine breaks off, flakes off. That's what causes a heart attack, uh, pops like a pimple, if you will. That is the stuff that causes the acute catastrophic event that we call a heart attack. It's
Yeah,
not the
that's
severe
such a revelation for
blockages,
me. Like I always thought
right?
that gradually the blockage happens, and then that's what I always
Right.
had in my mind is that's the really serious issue.
So you think of rust in a pipe, maybe an onion, right? Starts in the wall, in the pipe. You get, rust or a growth like an onion, right? Layers and it grows no inward. No, years and years, it's growing outward. And it does that to preserve the donut hole. So we don't have any restriction in blood flow. Only late, late, late into the game does that plaque, when the vessel just can't expand outwards anymore, does that plaque begin to grow inward. But here's the thing. I want everyone to be very clear on this. We will not have symptoms, chest pain, angina, flunk a stress test, right? Have any awareness that it's there or flunk a stress test till that plaque has grown inward and we already have a 70% blockage.
Yeah, that's
Anything,
shocking. So you
eh,
could have a very much a false sense of, safety or security in regards to this
absolutely. So
particular
anything
area.
less than 70%, you'll have no symptoms and your stress test will be normal.
Mhm.
So here's the problem, right? So any of you who've been to a cardiologist, heard to a cardiologist, whatever, right? You go to the cardiologist, they do an EKG, worthless, right? An EKG might tell me if you had a heart attack already, but tells me nothing if you're going to have one. Offers zero information. Then he or she will say, well, let's do a stress test, right? And go, okay, I go to cardiologist, I get a stress test. So by the way, heart caths, 70-year-old technology has really not changed much over the last 70 years. Um, Stress testing we began to do in earnest in the 60s and 70s. So that's 50-ish years old. And again, the stress test will only detect blockages greater than 70%. And I think that's important. I mean, we know it. Every cardiologist knows this, but we don't do a very good job educating people. And I think probably, honestly, I understand why. Because if people really knew
Right.
that, they'd go, well, that's not a very helpful, useful test. Imagine we're talking about cancer, and I just invented this amazing new cancer test, but it only detects stage 4 metastatic cancer.
Yeah, that's pretty
Probably wouldn't
terrible.
be too helpful, right?
No.
Well, what about stage 1, 2, and 3? Well, we can't detect that. But stage 4, I can detect all day long.
Right. Where it's very hard to do anything, it's a
Well,
lot
yeah,
harder to handle things
that
at
ship
that point, right?
that ship has sailed largely,
Yeah.
right?
And we have
And
to
so that
remember, I want to hit home that, the blood is it's like the ship that all the things that you need are the food to your cells, the oxygen.
right.
So if you're at even 50% of capacity, you're struggling.
Well, but here's the thing. Our vessels, so here's another point. Most people don't know. Our vessels, the blood vessels, these pipes are way bigger than they need to be. We have huge
Mm,
reserve. We will
right.
not restrict blood flow down that pipe, down our blood vessels, until we have a 70+% blockage. Up until that point, no
Okay.
symptoms, normal stress test. I feel fine. You'll have no awareness that there's anything going on.
Interesting.
So the good news is our vessels are bigger than they need to be. We have lots of reserve. The bad news is when we start having symptoms or flunking a stress test, we don't have a little bit of disease. We have really severe advanced, again, I'll use that cancer analogy, stage 4 disease.
You're right.
So you can see where we're headed. So over 30 years ago, when I did my training, I saw, wait a minute, there's some lumpy, bumpy stuff in the vessels. That's not completely normal, right? We didn't think it was important. We just said, go back home. It's all good. We'll let you ripen up, come back when it's 70%, and then we'll fix you. And I thought, but wait a minute. To use an analogy I use all the time, what we were seeing is really kind of a polyp, the same sort of analogy to how polyps cause colon cancer. We were seeing the polyps, but we didn't think it was important and didn't even act upon it, right? And I
Mm-hmm.
thought, that's a problem. And then, as I learned about heart catheterizations and stress tests and all that, and realized that they're very insensitive, they only detect severe disease, they never detect early disease. You can see I got pretty disenlightened and thought, we have to do better. There's got to be a better, more accurate way of detecting this disease. There has to be the equivalent of the cardiac colonoscopy, right? The mammogram, the pap smear, all those cancer tests we do to screen and detect very early cancer. There has to be a better way for us to detect heart disease and plaque literally years or decades before we get a blockage or start having symptoms. Or by then, you probably have such extensive disease that we probably need stents and balloons and surgery. But here's the deal. If we can find it early, take care of it early, we literally can stop plaque. We can reverse plaque. I think that's amazing. People say, oh, you can't stop and reverse it. Absolutely. We have proven tools, multiple proven tools that can stop and reverse plaque. We've had those for a while. They keep getting better and better. The pipeline that's the tools we have are incredible. We have a very big toolbox of things that can stop plaque, all kinds of different tools, pharmacologic, non-pharmacologic, all kinds of things. However, the biggest problem in cardiology, our major failure is early detection.
Mm-hmm.
Right now, we just wait till you have symptoms or you have a heart attack. And by the way, if you wait till you have symptoms, the first symptom in half of men and two-thirds women, the first symptom of heart disease is you die.
Yeah, that's pretty terrible. Obviously there's not much time to do anything if the
Right.
yeah.
So
Uh
that's the exact opposite of early detection.
I had a conversation with Sherry Thacker, who's the one who connected us, and she was explaining to me some of the tech. And one of the things she said to me struck me quite a bit, which was that it's recommended and it's sort of the standard process for people at a certain age uh, to look at and get tests for your colon. Like you go and you get a colonoscopy,
Right.
and percentage wise, those serious for those who have it, the percentage wise for the overall population for colon cancer or colon issues is pretty small. But then we don't have that similar type of thing like preventative approach for the heart, which is a way more serious issue for more people.
Right. Yeah. So, I mean, to put those numbers in perspective, and again, I tell my patients all the time, I am here to save your life from heart disease. We can prevent it, we can detect it, we can monitor it, we can treat it, we can reverse it. But at the same time, I do not want to save your life from heart disease only to have you die of stupid preventable diseases like colon cancer, right? So I tell them, make sure you get your colonoscopy and your pap smears and mammograms, all of those things. But let's really change up the game book on how we think about and detect heart disease. No longer so late in the game where you might need stents or balloons or surgery. If your first symptom is not death, but we really have to focus on how do we detect it early. And as it turns out, back in the mid 90s, I saw this. I thought, hey, we're seeing some lumpy, bumpy stuff. This is important. Everybody else blew it off. And so there really wasn't back then anything like a preventative cardiologist. We didn't even have the term. Prevention wasn't even in it. We were just completely reactive. You get a
Right.
blockage, you survive it, you didn't die, we'll fix it, balloon it, stent it, whatever, right? So it's completely at the end stage of that disease. So there really wasn't even the term preventative cardiologist. So I basically said, we got to find better ways of detecting the early disease. So I basically self-trained myself, and that's how I ended up getting 7 boards in everything from, stress echocardiography to nuclear cardiology to cardiac CT, to clinical hypertension, internal medicine cardiology, cardiac CT, and echo. So 7 boards along the way. But really, what I was doing is there was no path, there was no training program for preventive cardiology. So I just kind of invented my own. Go, I need to know about, oh, and also board certified in lipids. There's only about 100 cardiologists that are board certified in cardiology and lipids as well. Unfortunately, a very small number, should be much larger. But I really kind of put together all those different sorts of training, really realizing we got to image it, we got to detect it early with imaging, just like we do mammograms and colonoscopies and all those things. And then once we find it and detect it, then we need to have a very effective way and a variety of strategies to be able to, once we detect it and detect it early, to be able to stop it and yes, actually be able to reverse the disease. So that was really my training for the first roughly 15 years of my training. And then this is now almost 30 years for me in practice doing preventative cardiology.
Well, I think this is so important, and it's a huge part of my focus is let's not wait till we're in a critical situation to make a change. Let's see what we can do to try to, avoid that and also just feel better and have, better health overall before we would even get to a critical situation.
I think of, okay, we have the jaws of life, we have trauma hospitals, or we have seat belts and airbags. So I'm more on
Right.
the seatbelt airbags kind of approach.
Absolutely. Let's do what we can to prevent getting into that situation. And then what I feel is really important here to address is what the tech that you have access to, and that is not the tech that people are going to get when they go to their local doctor or hospital or cardiologist. And I do find that this happens in a lot of industries where, for a variety of reasons, there's a certain established tech, it gets put in place, and then it becomes way outdated, but all the infrastructure is now around that tech. And even when new tech becomes available, there's just not an update. So I used to live in China. And as
Oh,
an
wow.
example, it was wild because one of the things that happened in China is they just skipped like landline tech.
It just
Mostly, they just
leapfrogged,
went right to like,
right?
we have the highest fiber internet and everything. So, and in that way, they were like ahead of the United States because they weren't kind of bogged down by the old tech. They just went right to the newest best, whereas we were still using all this old infrastructure. So I feel like that's happening in a lot of areas in medicine, and it's not just, medicine. We see this in aviation and a lot of other areas as well. Since you were interested in being a pilot,
Right,
like airplanes haven't really changed too much in a long time.
right.
So I think it's important for us to understand this and not just go by whatever we're told by the experts in our circle, because they're probably giving the best thing that they have access to in their given situation. But that doesn't mean that it's the best thing out there.
Oh, absolutely. I think if I were to make an analogy, kind of what most of my colleagues are using, and I really feel bad for them.
Right. This is no
They're kind of
criticism
doing,
to them. I want
this
to
is
be
what I,
clear.
yeah, this is what I was trained on. This is what I do. It works for me. And then I like to say rinse, lather, and repeat, right? Just keep doing it, right? Most of the technology that my colleagues are using would be akin to 8 tracks and cassette tapes. I wouldn't even say they're a CD disc or a DVD disc. They're more 8 tracks and cassette tapes. Really technology from the 20th century. Um, and none of us use those things anymore, right? They're kind of museum pieces. They're cute, right? Uh, but people don't really use those things anymore. Everything's fiber and optic and streaming and all that stuff. So I always have been absolutely committed to being very aware of all the technology, learning about it in depth, and then whenever that works for me and works for my goals and works for my patients, we execute. And that's where we've sort of evolved to this kind of technology. So the state of the art technology now to be able to look at the heart, early detection is really combining multiple different things. One
Yeah,
is
I'd love to
on,
hear like
yeah,
what that scan
yeah,
is like. What first of all, what it does, what you can see, and then also what is the process for getting the scan?
sure. So first of all, if you go to a cardiologist, they're worried you have some heart disease, you have symptoms or something going on, family history, or got diabetes or high blood pressure, cholesterol, or smoke, or any of those things, right? If you go to a cardiologist, the first thing to do is an EKG and say to get a stress test. I'm going to encourage you to run because that's 20th century technology. It really has no value. And I will be very, very honest. I'll be very transparent. Hopefully, no one will flatten my tires. Um, the stress test, incredibly insensitive, has a 25 to 40% false negative rate. That is, you do have a severe blockage, more than 70%, but the stress test looks fine. So you actually get reassured inappropriately. And I can't tell you how many people, they literally get patted on the back, say, got the heart of an 18-year-old, and then an event happens the next week, the next month, right? Happens all the time. So 25 to 40% false negative rate. The stress test doesn't pick up the problem, even when there is a severe blockage. And then the flip side occurs, a 25 to 40% false positive rate where the stress test looks funny. Then we would take those poor people to the cath lab, spend $20,000, put catheters in their groin, do it again with what is really 20th century technology, only to find out they're fine. There's no blockage. Still $20,000. Hopefully, no complications ensued. You didn't die, have a heart attack, damage your kidneys, bleed, infection, all the complications that can occur with a heart catheterization. And unfortunately, your grandmother was an example of that.
Yeah, so just to be clear, when you put something in the vein, you can dislodge something, which then causes its own problem. So in an attempt to get a diagnosis or, understand, you actually cause a problem that's actually really serious.
Absolutely.
Yeah.
So now the state of the art is we have these very high resolution CAT scanners. So that's the donut. Okay, it's not I call it the coffin or the tube. That's an MRI. It's not an MRI. It's an open donut. When I started out 20 years ago, uh, our first what we call multi-slice CT, did 64 slices at a time, 64 very thin slices, right? That was 20 years ago. I call that the iPhone 1. Nowadays, 20 years later, our machine is 640 slices. So that's what's happened over the last 20 years. With that, we take a whole bunch of very paper thin slices through the heart. We can acquire the entire heart in one revolution of the CT machine. We get all that data in literally 1 second. So it takes 1 second to get multi-gigabytes worth of data, which we then take on our computers. We reconstruct your heart. We take all that high resolution three-dimensional imaging. We reconstruct your heart on our display stations, and then we literally have a picture of your heart, your vessels, the heart muscle. But most importantly, for our purposes, is to look at the blood vessels and see if there's plaque. So that basically recreates your heart on our computer.
And
We
it's
can then
essentially it's like a 3D scan, right? So
absolutely,
it's not
it's
just like a
100% 3D.
two-dimensional,
No,
flat
no,
image. I think that's
no.
really important for people
Yep,
to understand. And it's in color,
it
so you
is.
really
Yeah.
can see what it really looks like, which is fascinating to me.
Yeah. So we'll see. Maybe we can throw some pictures up on your website too, and kind of give an idea what people what this looks like. But yeah, so it's all high resolution three-dimensional imaging. Then we can deconstruct your heart, take out the coronary arteries, where that's where plaque builds up. Take those vessels, straighten them out, turn them, spin them, rotate them, fly up and down them, and that was a major, major advance even 20 years ago. Okay. Now, again, we've gone from the iPhone 1, 64 slice, now to the iPhone 16, 64, 640 slices. And I'm also proud to say that this particular machine that we have, the 640 slice machine, was the very first installation of this machine in North America. So ours is the first. There's now 8 others that exist, but ours was the very first install.
Yeah, I want to hit that home because there's only 8 in the entire United States. So the
That is
likelihood
correct.
of you having access to this is pretty small. And what are the types of other places that have them besides your
So,
location?
so, so CAT scanners are used. I mean, I think probably many people have heard of one or had one or family members or friends. So CAT scanners are pretty common these days. We have thousands of them in the
Right.
US. But the ones that have the high resolution that are very fast, it's like taking, the heart, unlike any other organ, moves, right? So we have to take very fast pictures of it, like a car, to stop it, to freeze it, and that's really where our machine is really remarkable, being able to stop the heart, to freeze the heart, if you will, virtually, so that we can then get these beautiful three-dimensional pictures of the heart and the blood vessels, et cetera. Plus, very high resolution. We can then take now, and this is the big advance over the last few years now, I can take that high resolution three-dimensional data. And by the way, before we get to this, when we do the scans, we're going to get everything else inside your chest. So we'll be able to look at your lungs, your esophagus,
Oh,
your
wow.
stomach, your
Hmm.
spleen, your aorta, look at your bone density, see if you have fatty liver, see if you have aneurysms of the aorta, see if you have holes in the heart, congenital abnormalities, valve issues. So we get all of that data for free. And of course, I'm going to extract every little bit of data that we can because it's all in the image set, if you will. And then ultimately, we want to get you know, look directly at the blood vessels, which we do. But before we do that, I like to look at all the other stuff because we get all that for free. And I've found lung cancers and esophageal problems and and liver tumors and spleen issues and stomach things and hiatal hernias and all kinds of pathology over the last 25,000 scans. So that's all free. Oh, bone density we can look at. I found, crazy things in people's spines and
Right.
scoliosis and osteoporosis and all those things. So we get all that. But now the big, big news now, we get that high resolution three-dimensional image. Literally takes 1 second to obtain that data. Then all the other processing is done on our computers. And then now we can add AI on top of that. Of course, everything's going AI. So what we do is take AI, it analyzes all of the millions of pixels that make up these images. Technically, they're voxels because they're little boxes, but millions of these pixels make up this high resolution three-dimensional image. The AI will look at every single one of those millions of pixels, will determine if there's plaque in that pixel or not, and then be able to identify and see plaque literally that we cannot see with our eyes. So when the data comes out of the CT machine, every one of those pixels is encoded with 2,000 shades of gray. Our eyes can only see 50 shades of gray. Okay. So literally, it's going from seeing red, green, and blue to with the AI, I can see infrared, ultraviolet, gamma rays, radar waves, microwaves, the entire electromagnetic spectrum. So, A, we can see stuff that we could not see just with our eyes alone. And B, it will then measure exactly how much plaque we have down to a tenth of a cubic millimeter, which is about a tenth of the volume of a period at the end of a sentence. That's
I think
how
the
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 resolution that
key to
we have
this
now.
is the details and the ability to see down at such a detailed level. And I've had situations, so I, as a psychic medium, I could see a lot of health issues before they have previously been able to even be diagnosed
Mhm, mhm.
given a lot of the tools that are out there. I had a client came in and I saw a lot of dark energy around her chest, and she was later diagnosed with advanced metastatic melanoma in the heart, sternum, and lungs. But a lot of the, if it's early on, a lot of the current testing that's done just can't. you can't see it yet, right? It has to, it's like you were saying, it has to get to 70% blockage or 70% seriousness
Right.
before a
Right.
lot of these tests are able to detect. So that's a real problem. You obviously don't want to wait till it gets that long. So I want to hit that home, the importance of the details of this. Also, I'd love.
I like to call it
Mhm,
the
mhm,
virtual autopsy.
I just don't like the word
And
autopsy because I think it makes people think of
emphasis on
death.
virtual, not autopsy. But this one you get to walk away from, right?
Yeah.
So
Yeah. It's so detailed. So this is really important. You get to really see what's going on, what's really happening in real time. And then what are the types of approaches you take for medication or clearing that plaque? Because I think that's new information for a lot of the information you might have heard is like once you have the plaque, it's kind of there. So all you can really do is reduce the addition to the plaque that's in your
yeah,
system.
no, so one myth we got to bust on your show is this is a reversible disease. It is a two-way street, right? Um, so there's a lot of things we can do to stop and treat plaque. So once we do it, once we know it, and we can look at it, measure it, detect it, measure it down to a tenth of a cubic millimeter, we can break it down into multiple different kinds of plaque. There's the soft plaque, which is the active plaque. I call that the lava. There's the hard plaque, the calcified plaque. That's the extinct volcano. We can see that, measure it, detect it, quantify all those plaques. So we can get a fantastic baseline, know exactly where you stand. On the treatment side, this is where it becomes very, very personalized to the patient, right? This is where, I have one foot in the imaging world to be able to get all these beautiful, gorgeous pictures, understand exactly what's going on in a very black and white binary way. But then the other part is on the preventative side. It is all of the different tools. We have a very, very large toolbox of things that we can do to stop and reverse plaque. A lot of this, of course, is non-pharmacologic, which is phenomenal, right? So obviously, if we use tobacco, and I'm going to say tobacco of any kind, and I'm just sharing with people the data. I'm not pointing fingers, and I know that people that use tobacco, it's an addiction. It's worse than heroin. But tobacco of any kind, as I like to say, whether you snort it, smoke it, chew
Vape
it,
it.
vape it, right? Rub it on your skin, use as colonic, I like to say. That nicotine will get in your body. It will get in your blood vessels. We will absorb it. And literally on the lining of the vessels called the endothelium, which is critical. That lining is really like a slip and slide, right? It's like Teflon. If you smoke, if the nicotine interacts with that wall of the blood vessel, it will then turn that vessel from Teflon. It will become very sticky. It goes from Teflon into Velcro if it is exposed to nicotine.
Oh,
So
that's so
needless to
interesting.
say, there is no safe form of nicotine, no matter how you get in your body. Um, so obviously, tobacco, 70% of us are overweight or obese. That's a big, big issue. Clearly, that causes a variety of things, including insulin resistance, high blood pressure, cholesterol issues, plus any number of other things, fatty liver, joint disease, sleep apnea, reflux, on and on and on. That's an issue that has to be really work with people, to work with them to try to help lose weight, hopefully prevent diabetes, or if they have diabetes, improve that. So clearly, diabetes, insulin resistance are absolutely critical as well. High blood pressure is critical. And I'll tell you an interesting thing about high blood pressure, right? You kind of blow that off. It's the silent killer. It can be high. You feel fine. Just to understand, half of US adults, and I'm just talking anyone over 18 in the US, has high blood pressure. So half of the people we're talking to have high blood pressure. Many of them don't know they have it, because if you don't measure it, you don't know it. It is the silent killer. Generally, you have no symptoms with it. Half of US adults will have it from the age of 40 onwards. And I know you got a long time before you hit 40, but from the age of 40 onwards, the lifetime
I'll tell
risk.
you a secret. I'm 47.
Wow. Okay. Well,
So,
I'm
but
glad I
still,
just
yes, even
I'm
more so.
glad I deal
I
with
need.
below the neck and above the diaphragm, and I'm not the guy guessing your age because you have me on that. So anyway, so from the age of 40 onwards, the lifetime risk of developing high blood pressure in the U.S. is 90%. That's
Yeah.
90.
And we kind of joked about it just now, but regardless of what you look like on your,
Oh, absolutely.
aesthetically, what's
Yeah.
going on underneath may be completely different. So,
Right.
this is, and as you said, half the people over 18. Well, I mean, yeah, you could be 19 just out of high school and have
Have high
this,
blood pressure.
have high
And
blood
odds
pressure.
are
Yeah.
no one's probably even checked it because you're 19.
Right. Yeah. Unless you're going in, getting it's a standard
Right.
thing for some kind
Right.
of, test or
Right.
whatever.
It's sort of accidental, right?
Right. So I want to hit a little bit on the topic of the sort of energetic aspect. Of course, I'm
Mhm.
very in tune to that as a psychic medium. And one of the reasons I started this show is because I was really struggling. Like I wasn't feeling good. And everything you're talking about, I was going to the doctors and they're like, everything's within normal range. Everything's fine. I'm like, I feel terrible. This is not good. What's going on with me? And I had to be my sort of own detective and figure out what was going
Yeah,
on. And then I was able to
sure.
self-diagnose, which I did. But from an energetic perspective, the heart is really important. Like the heart and the
Yeah.
circulatory system, like in TCM, it's considered the emperor for consciousness and our emotions. So if there's something not right there, it's going to deeply impact you emotionally and spiritually. So if you're struggling emotionally, spiritually, please look at your heart. Please,
Yeah.
go to
Oh,
Dr. Osborne,
absolutely.
ClearCardio. Like this isn't just a physical issue. This deeply
Right.
impacts so many things, your emotions, your emotional state, how you're able to have your resilience, do you feel strong? And it's associated with joy and happiness. If you're struggling to not have joy and happiness, there's probably something going on with your heart. So I think that's
Oh,
really
no.
important.
Yeah. No,
Yeah,
no question.
depression is
And
like such an issue. Mental health issues are such an issue. And I feel like that's one thing that isn't really addressed very much in society is the biological, physiological
yeah.
things that may be causing a person to feel depressed.
Yeah. Yeah. And stress kills. How
Hmm.
does it kill you? It kills you via your heart attacks and strokes and, causing you to gain weight and getting stressed out. And then you eat more and then your blood pressure goes up and then your blood sugar goes wonky and your cholesterol goes bad. So, I think this issue of balance and really being holistic and knowing yourself, and really, it starts from the head down, right? So
Absolutely.
I absolutely 100% agree with you. That is something that is absolutely critical. And what we do is take a very holistic approach, right? We got lots of tools, and I think you really hit it on right on the head as well. And it's meditation, it's relaxation, it's understanding, it's treating sleep, right? Sleep is a massive, massive issue, right? If you do not sleep well, we're going to spend hopefully roughly about a third of our lives asleep. If you do not sleep well, if you do not have good sleep hygiene, if you do not have restorative sleep, how do you think your body's going to cope with that? It's not, right?
Absolutely. So I think we have to deal with all these and look at these things in a holistic perspective. So I love that you're a holistic heart specialist. And I actually, since you brought up sleep, I'm going to connect you with another doctor that was on the show, David Shirazi, and he's actually a dentist that specializes in helping people sleep better. And it's the
Sure.
same thing there. A lot of people don't realize that they have sleep apnea. Like many
Yeah.
people don't have it, don't realize. And thin women is actually half of sleep apnea. So you
Right.
could be
Right.
you could think, oh, what does this someone with sleep apnea look like? Oh, they're a heavy man with a big, neck or something. And
Sure.
it's
Right.
like that's sometimes, but not always. So there's a lot of education needed for us in terms of what's really the issue. Like you said, there's a lot of people get the cardiograms and or stress tests and they're told that it's fine when really there is something that needs to be
Yeah. And
addressed.
you know
So
what? I would say after that, you know nothing more than before you started.
right. Yeah. And so I think we have to be our own health detectives, really. That's what happened with me. I was getting all these tests. Everyone's like, you're normal. I had to self-diagnose. Then I went and got the confirmation that's what was going on. And then I was able to heal. So if you don't know what's really going on, it's very difficult to know how to heal yourself. So this is really, really important. Thank you so much. I love everything that you're doing. I'd love to just ask if there's anything else that you'd like to share, any additional pieces of information.
Yeah, again, heart disease at this point, we have done a horrible job, and I'm going to take the burden of cardiologists. We've done a really, really horrible job on early detection, right? But the technology is there. It is out there, right? I always love to quote William Gibson, the guy that gave us the term cyber, right? He said, "The future is already here, but it's just not evenly distributed. So you
That's
may
a
go
great way to
to any
say
number
it.
of my colleagues, and they're going to get you an EKG and a stress test and all that. And I'm going to tell you, it's worthless, right? You might as well flip a coin. You get better data. But the technology does exist right now. It is available. The ability to very quickly, rapidly, accurately, precisely detect, measure, track, monitor plaque, that'll exist. That technology is here. We use it every single day. And I would ask any of your listeners, right, if they go to a cardiologist or somebody and they say, we need to do a stress test, run and just check us out. We got lots of educational videos. This is what will be the standard of care. Uh, I'm a preventive cardiologist. There are very, very few of us. Unfortunately, there should be a lot more. But the technology is here, the knowledge is here, the tools are here. Just like you with your travails and your journey, you had to be your own advocate. You had to,
Yeah.
keep looking. You didn't just take no. So all I can say is don't take no. Uh, Come to see ClearCardio. So check out our website, check out our YouTube channel, ClearCardio. I think it'll be very, very enlightening, very educational. And again, I really appreciate your commitment to work for us to work together to eliminate heart disease. And I always lean on my patients and say, at the end, when I talk to them, I've got a big ask for you. Okay. This is where I'm going to ask a lot from you. My big ask is ultimately, I want to eliminate heart disease. And I want you and everyone else listening to work to put me and my colleagues in cardiology out of business. Okay. So please work to put us out of business. That would be what will make me very happy.
I love this. And so for everyone listening, you guys are located in Dallas, Fort Worth
We're in Dallas,
area at
Texas. Yeah,
this
in
time.
the
Yeah.
Dallas, Texas area,
Yeah.
Dallas Fort Worth
Yeah.
area. Yeah.
Yeah. So I am definitely planning on coming down and having this because especially the heart disease history in my family.
Well,
And
whenever I hear the genetics and your
yeah,
grandparents
of
and
course. I mean, this is a real thing. And then,
yeah,
like I said, I'm just a big believer in preventative and, not waiting for something to get to where you're in a critical situation, like an emergency
absolutely. And it
situation.
just should no longer be the case. Now, the flip side is with this, right? It is so accurate. It is down, I call it the microscope applied to the heart. If there is no plaque, there is no plaque. I'm not saying maybe, could be, your EKG looked okay, your stress test looked okay. When we do this test, we will know if there is a speck of plaque in your heart, and we will see it and
Yeah.
detect it. So it is a freeing test because we can de-risk lots of people who have a family history, worried, I'm doing all the right stuff, I'm eating right, exercising, not smoking, doing all the good stuff, blood pressure great, but is that enough? Or is there some other genetic hickey that we haven't looked at, uncovered, that could be teeing me up for heart disease? With this tool, if it's there, we'll see it. And if it's not there, it is not there. Hundreds,
Yeah, it's
full
such
stop.
good mental health,
Sure. And
peace
if
of
we
mind, I
do,
should say, peace of mind to know
yeah,
what you're dealing with, to be able to address it if you do have an issue, or to just know, okay, things look good. And that's a great thing to know.
and so either we're fine, and we've seen people literally cry because they had horrible
Mm,
family history. One lady, one of our first ladies, her dad died in her arms.
mm,
So for 30 years, every day is today my day?
yeah.
Bottom line is, we put in the scanner, nothing there. It was perfect, right?
Oh,
She
I mean,
literally cried just with joy, knowing she didn't have to worry anymore. It just wasn't
yeah,
there. And I can say that 100% black and white, end of story, right?
that's
Um,
incredible.
so yeah, I have to pinch myself every day doing what I do. I love to say I never get paid. I never worked a day in my life. I just get paid to do my hobby. But ultimately, along the way, hopefully we'll save some lives and make people feel better and just reassure them. So whatever we find, it's fine. If you're normal, we know it beyond a doubt. Or if we find something, it's all fixable, right? If you're
And
breathing and have a pulse, I can help you.
I fully believe that. I believe that whatever we've been told, there's always a solution if we can find the right approach. I fully believe
Absolutely.
that as long as you're still here. And there's even people that technically
Exactly,
die and come
right?
back and they heal stuff. And if you are feeling to do this, please do it. I strongly believe in intuition that you know strongly. So follow that urge, that hunch if you're feeling to explore this. So thank you so much, Dr.
It has been an
Osborne,
absolute
John, for being
pleasure.
on the
Thank you
show.
again, and thank you for getting the word out on preventative cardiology because we so desperately need it.
Yeah, this is really important. And I believe in the sort of ripple effect that, you help one person, the whole world can change. Our impact is deep. And so, just by helping one person, we can really change the world. So thank you so much. And we are going to put all the information about, this tech and John and ClearCardio in the show notes and information. Thank you, John, again, for being on the show.
It has been an absolute pleasure. And again, thank you again from the bottom of my heart. And I hope we can have continued discussions on how we're going to work to eliminate heart disease in the future.
I'd love that. Yeah, what I would like to do is come down and have the experience of having it myself because
Sure.
then I can speak to it. It's so
Yeah.
great when you can
Your
give a specific
your mind
history.
your
Mhm.
mind will be blown as well as I tried to describe it in words until you see your heart floating around in space. It's pretty amazing. So
Yeah.
anyway, you're more than welcome. I hope we have a chance to do that.
Thank you so much. And thank you everybody
Pleasure.
for listening and for connecting with us and for taking care of yourself. You can't be effective or do your purpose if you are not here. So please take care of yourself. You are worth it. Any resource that you put into doing this, I believe, comes back to you in the end because you are going to be in a better place in the future. So thank you and many blessings and wishing all of you wonderful health and abundance.